Hi, my name's Michelle Myberg. I'm a doctor that practices in Bloemfontein in the middle of South Africa. I run an emergency department here, and I'm about to complete my studies in pediatric emergency medicine through Edinburgh. I just wanted to reflect a little bit on how it's been these last few years. As a person who runs an emergency department, as a mother, as a wife, as someone who's seriously got a passion for studying and learning, it's been quite an interesting experience. I was quite apprehensive when I started the program. I was a bit worried that I wasn't going to be able to get to everything that I need to get to. I was also a little bit worried that I wasn't going to be able to connect or find it meaningful in a way. It was in the beginning quite difficult to get into a new routine, but with the support of the staff there and the interesting topics and the flexibility of the program, it wasn't a long time before I started learning and getting involved in the program and feeling like it was really challenging me beyond what I was busy with currently. Even though I work with adults and pediatrics, it was a fantastic experience to look forward daily to new discussions and new case scenarios and to work through that. What specifically happened this last year is that we had to do a few tasks, management tasks amongst ourselves. You're divided into groups and you work with a group of people from across the world. We were all in different situations, different scenarios. And I had to lead up a task which was about surge management. Now, when we started the task, we were allocated it, and it pretty much went over pediatric surge and what to have in place for, say now, a pandemic or a mass casualty incident. And I remember asking my group if any of us had had personal experience, about with such thing. Now, you must remember this was before COVID, well, initially before COVID. And all of us had actually said, no, we don't really have much. So we allocated the tasks and we started working on it, only to a month or two later to be in the middle of the task and in the middle of the COVID pandemic. What was so special about this for me was that for the first time, I really felt like a topic was, or something we were reading about was, we were directly using it in our everyday lives. I remember reading up things from the WHO influenza pandemic and actually presenting it at management meetings that I'm part of here at my own hospital. And in that way, I feel like the program really connected the two worlds. It wasn't the only thing where I felt that, I'd learned something from the program, but this just brought it home on the importance of this aspect of it. So I'd just like to say thank you to the department, to the pediatric emergency medicine staff. You've been fantastic. You've always been there, especially during this difficult time where the pandemic has affected all of us in very different ways, very personally, some of us, for just working around that and empowering us to be better doctors and to be better people and to understand in context what we can do to help our pediatric patients. So overall, it's been a very positive experience. It's taken hard work, but it's been definitely worth it in the end. And I'm looking forward to use what I've learned to improve the lives of the patients that I see every day in our setting, and to use what I've learned in the relationships with other students to hopefully change my world. So thank you.